whether or not Nigeria is also keen in into the many benefits of IVF. Of course, it's a story. Before now, it used to be hush. Nobody really wanted to talk about IVF. Nobody wanted to talk about assisted reproduction. But these days, conversations are being had. A lot of people are embracing, of course, IVF and other means of assisted help when it comes to couples, of course, being able to have their own children. And today on the program, we'll also be commemorating ahead of this year's celebration all the same. And we have in the studio this morning a fertility specialist who is also a general practitioner, Dr. Aisha Abubakar Adebi. Thank you, Dr. Aisha, for being on the program this morning.
Thank you.
Right. Okay, Dr. Aisha, you have to speak a little bit louder, oh, okay. So, just so that everybody can, have a feel of this conversation. Like I said, before now, a lot of people were maybe ashamed or didn't want to be identified with issues around IVF because everybody just wanted to look at it as, okay, it's a no-go area. I do not want people to know that I am seeking help to be able to have a child because, of course, hitherto before now it was assumed that, having children is a gift from God and, of course, it shouldn't be that difficult. But if you look at where we are in Nigeria now and the liberty or the rate at which people are beginning to approach assisted forms of, pregnancy and childbearing, where would you say we are?
So I would say for now, we are trying, but if you have to look at it, I think the European people are more into it.
Okay.
So we still have that stigmatization, like I don't want people to still know. I still have clients that come in, they'll be like, oh, I don't want this person to know. So I would still say we're a bit still behind.
We're still behind, even though the awareness is becoming more, but then we're still very behind. Yeah. Okay, Jubala.
All right. I would also dwell on Abimbala's question, talking about assisted reproductive technology, which is evolving. But our tools like artificial intelligence also assisting couples in the success rate of IVF.
So are we talking about AI now?
Yes.
So, well, people still go on their phone and Google things and the AI give them questions to ask. But we have not started using it in our lab.
Okay.
So, but I know people, because I just came back from a conference, from the European conference that happened in UK. So they are still working on that aspect where they can use AI to detect some things. So, but for now, I would say Nigeria, we are not into that yet. Yeah. Okay.
Right. So let's bring it back to, the nitty-gritty. In the first place, why people would even want to, approach doctors like yourself to look at assisted reproduction. If a couple, of course, give us the timeline of when a couple can be married and be trying naturally, and then if it's not happening, they can begin to reach out to doctors for help.
So that's us going back to the basis. So that's definition of infertility. So that's, let's say the definition of infertility is when a couple they've been together for like a year, that's 12 months. Okay. They've tried, they live together, they have uninterrupted sex, and it's adequate. So when I mean adequate intercourse, it means maybe 3 to 4 times per week, and not just timed around ovulation. And for a woman that is above, let's say 35, where the time frame is about 6 months, that she has been married and there's no, they are not achieving any conception. Right. So she should present to the clinic and start asking, why am I not getting pregnant? What are the necessary things I need to do? And apart from that, we don't just say, maybe we have different types of infertility. We have the primary and we have the secondary. So primary is when somebody has never gotten pregnant before. Then we have the secondary, where, okay, I've had a child and I still want more children. So the person too needs to present. And after trying for maybe like 6 months, 12 months, nothing is happening, the person still needs to present to the clinic to ask, what is happening? What do I need to do?
Sorry, Ajibala, just to come in, because again, you said if you've never been pregnant before and you're ready to start having a family. How about for those who, for reasons, best known to them before they got married, they got pregnant and they terminated, where would they fall into? Would they fall under primary or secondary?
So they'll still fall under primary because they didn't carry the baby to term.
Okay.
So they will still fall under primary.
Oh, okay. All right, Jibala.
Okay, oftentimes in this society when we talk about infertility, we usually focus on women. We under discuss or address infertility among men. So what's the rate of infertility when it comes to the male folk, and then what are the factors that can actually contribute to infertility for a man? Okay,
so before it used to be more of a woman issue, but these days it's both women and men. So if we look at the factors, well, we can say probably the lifestyle. There is more smoking, there is more drinking. All this affects the lifestyle. Then there is some people from birth, they had what they call moms, and maybe they didn't even get the vaccine. So I still have people still have that mentality that, oh, if you take the mom's vaccine, they can become sterile. But that's not true. So I still believe that men should still get the mom's vaccine. Apart from that, there is what we call, there can be obstruction. That means the man is not able to produce. So the man is producing sperm, but you can't find sperm cells in them. So maybe due to obstruction, due to infection, there are so many factors that can...
Can you dwell more on that?
So there's what the one that they call the blank. So by the time because when they produce sperm, so them thinking that fluid that comes out is the sperm, but sometimes that's not it. Yeah. That's just the semen. So you need to still use like a microscope. You can't see sperm cell with your eyes. So you still need to use the microscope to check if there is sperm cells in them. So the sperm cell comes after, not like when you just release the semen and you think, oh, something just came out. Okay. Yeah.
So that can be obstructed.
Yes, that can be obstructed. So probably due to trauma, due to infection. So, and sometimes it's not even reversible. Yes, some urologists say it's reversible, but it's not all that is reversible. So sometimes we need to go down to get the sperm cell. So that means doing like surgical sperm collection to collect the sperm from the source.
Okay, from your years of experience, have you seen men come out themselves to come and tell you that, okay, I think I'm having issues, I'm infertile, and I'm not able to conceive?
Yeah, it's happening, yes. They've come.
Okay. So how about those who also live in denial? Because for some, yes, they would agree after tests have been carried out and they will say, okay, I'm ready to seek medical attention or medical care. But some will still tell you, oh, no, I've impregnated somebody before. I don't think I have a problem. And I still, living in denial and are not willing to seek help. In such cases, how do you break through to such men? Because we know that also society plays a pivotal role when it comes to issues around fertility, when either the man or the woman still does not want to believe there's a problem. So how do we get through to people like that?
We can't force it, man. So we just let them be. So sometimes they'll go to different places, take different herbal stuff, then they come back on themselves. We don't force them, to be honest. You can't force them. So by the time they've gone to different places and nothing is happening, they come back. So, and they are ready to listen to you. But at that stage, you can't force them, to be honest. Okay. There's no amount of preaching, no amount of consultation. So, but you just let them be. So by the time they go and they've solved some different places, nothing is coming up, they come back. Yeah. I've had someone like that, so you can't force them, to be honest.
So let us go back to the age issue, because you mentioned earlier for people who've been trying, and especially women, at a particular age, it becomes really difficult for women to get pregnant naturally because of declining egg production and a whole lot of that. So take us through the years, especially for the woman. What's advisable? At what time in your lifespan as a woman should you just seek for assisted help rather than continuing to try, even though we can't rule out the fact that God still performs miracles?
So, well, we always say the peak of fertility is the age of at like 25 to 30.
For a woman?
Yes, for a woman. So after that 30 is difficult, but after 35 it's more difficult. So, but we can't say everybody should get married at 25. So, but there are methods where you can, let's say, preserve. So that's where we are going now, advanced like fertility treatment. That's like women can preserve their egg.
That's where you call freeze your eggs?
Yes, freeze eggs. So, but when you come at 35, we can't turn you away. We do your testing, but we still advise you and tell you that, okay, the quality might not be as good as when you were in maybe 25 or 20 something, but we will try our best and see what we can work with. And well, it's just more impacting knowledge to them and explaining to them that, okay, when you present at this, it has some from crisis management to trying to save whatever you have left. So we try as much as possible to just tell them that just come early, and that's why we have like this World IVF Day. At least is a way of trying to reach out to women. And I'm just glad that these days women are coming early, and at least before that 35, they are all coming in to say, okay, I would like to freeze my eggs, even though it doesn't come cheap, but they are coming
Before we talk about the money, this also, some people are also beginning to raise a eyebrow concerning this freezing of eggs, and saying that maybe this could also permit women from getting married, because if you freeze your egg and you know that maybe at some particular point in time when you're ready to have children, you may necessarily not get married, you could also get some form of assisted to you know, have your baby. And then some people think that perhaps this also is having a negative impact on raising or building families. What do you say to this?
That's actually very difficult to answer because I think fertility should be more of a choice. What if you wait and the right guy is not coming? What do you do? Some people have faced abuse from maybe relationship, and she has decided, okay, I don't want to get married again, but I want to have but I still want to have kids. So that kind of person, what do you do? To be honest, so I can't really say. That one is still a choice, to be honest, still a choice. And I'm just glad that, as I say, women are really coming up these days. As long as, like, where they'll say they're not finding the right person, but I still want to have my kids in the future. I don't want to have to make decision that, okay, I can't use my own eggs again. So I still feel it's still about choices. It's still about choices, to be honest.
Okay, honestly, I must confess, I'm beginning to get lost in some of the issues that people are discussing. But let's talk about the egg freezing. Take us through the process, and how reliable is this technology?
So, for African, we are getting better, to be honest. Before, it wasn't a process that we could advise people to do. But our techniques are getting better in freezing the eggs. So it's like you come in, we test you, you see that, okay, the eggs are okay. We try as much as possible to get like many or that can, because it's not, let's assume you freeze like 10 eggs.
Not all of them will be viable.
Exactly, not all of them will be viable when you need them. So we try as much as possible to say, okay, freeze more when you can.
Okay.
Yes.
But is it affordable?
Let's talk about the costs.
And what are the options for a man? I don't have an egg.
No, you have sperm cells.
Do you freeze sperm cells?
Yeah, we do, and we do actually, because right now too, as I said, it's more like we have the male factor and the female factor, and we are on the same level as of now. Before it used to be more of the women. Okay. So some men now, to be honest, they come in and they say, I want to freeze my sperm because I don't know what will happen in some years. So yes, the way women enter menopause, I don't know what to call the men's zone, but he's not going to be like the way he used to be.
Of course, as you are aging, you are declining.
Exactly. Right. So men will always have sperm, but it won't be as viable as the way it used to be, or motile the way it used to be. So men too are coming in to freeze their sperms.
So at what age would you advise a man to come in and freeze his sperm, and what is the cost implication for the two of them?
So I won't be able to say much about the cost implication because it's tailored on individual. Okay. So what A will have will be different from what B will have. So
but is there a range?
no, I won't say that. So, but when you come in, we'll give you a range.
Oh,
You assess first?
Yeah, we'll assess first. So, and we'll have to tell you, as I say, what A will get will be different from what B will get. So everybody will have a different price range. So, and it depends on what we call affordable, actually. So some people can come in and say, okay, this is what I'm earning, and this can actually take care of whatever it is. So it's more like paying a rent to freeze them. So it's like every year I have to pay, I have something somewhere which is valuable. I have to just
So do you pay every year, or can you stretch it to the number of years that you want to?
So it depends on your pocket, to be honest.
Okay.
So if you say, okay, I want to freeze my eggs for 5 years, like what is the amount I will pay, then that can be tailored into your pocket, your shoes.
So the age range for a man that wants to freeze his sperm, at what age would you advise him to do such?
For now, there is no age range, but when a man comes in and get tested and we see that, okay, this is declining, I actually have a client that I know that, okay, you saw that, okay, this is declining and I still want to have more kids in the future. Can I freeze them? Yes. So I won't just, for men, I can't really say that there's a specific age, like the women. So a man can come in at 45 and say, oh, just randomly doing a test and, okay, still has sperm cells. I can say, okay, do you want to freeze? And he say, yes, that's this thing. But I'm just saying, like, I know there was some research that men after 45, like, they tend to have autistic babies. So
Autistic babies?
Yes.
Because of the quality of their sperm?
I think so. I don't know. It was just like research.
Okay.
So I have not really dwelled on that to know what exactly it is. So, but before you get older, so I think it's just come in and do your test and freeze your
Okay,
sperm.
all right, I have a question, but my colleague Joe also has a question. Joe, let's take your question first.
Stories of people entering early menopause, especially from maybe 35 years. And, you know, we are very, very religious on this side. We are very quick to judge things from the spiritual angle. So my question is, how much awareness is there, especially for women, to begin to check or know that there is something called the early menopause?
So we call it premature ovarian failure, actually. So that's when a woman, we won't say she's entering menopause. So that means her eggs are failing earlier. That's this thing. So I've seen a lady that before 25, she actually entered that.
25.
Before 25?
Yes. So I won't say, so I would just say come in when you think you are ready. Or when you start seeing signs that, okay, my period are not regular. There's something happening to me. Like, okay, I used to have maybe 3 days flow, and now it's like 1 day. What is just happening? So I think women should just take note of that and just come in and just get tested. That's just it.
So you have to know your body.
Yes, you have to know your body. Yes,
right, absolutely. All right. As we go back to issues around fertility, let's also talk about the process, the IVF itself, and is it the last option when all other options have failed? I know, of course, that there are medications before certain things, and then I know there's also IUI before IVF. So tell us, is IVF the very last option? And when eventually you prepare a couple for IVF, what are the things that you say to them? Because I know that usually there's also it could be 50-50. Well, we cannot guarantee 100%. So take us through what the range is when you're preparing a couple for the process.
So I would say it starts by breaking the silence. So it's when a lady comes in without her partner.
Okay.
So you start asking, why do you come without your partner? This is both, like, you people have to be on the same page.
Right.
Not only the woman should get tested, the man too should get tested. So by the time a woman comes in, we'll do the necessary test. The man also comes in, we do the necessary test too. So by the time we check and we say, okay, there are other options, just like you said, the IUI. So, but we'll give a time range that, okay, this couple, she's less than 30. She just got married maybe last year. she hasn't tried any fertility treatment.
Okay.
Yes, I can actually suggest IUI for her, not necessarily
Go
the
to
IVF.
IVF.
So if you've done like three sections or cycles of IUI and she's not getting pregnant, then we'll move to IVF.
Okay, I'm sure that a lot of people might not even understand what IUI
Yeah.
is. So maybe you want to explain what IUI is.
So it's like, so we have the normal conception.
Okay.
Then we have the IUI, that's intrauterine insemination. So intrauterine insemination is the woman comes in, we do a test, we see that, okay, she menstruates regularly, she has been having regular and adequate intercourse, but she's not getting pregnant. Then we've assessed the man's sperm, so we give her some medications like tablets.
Okay.
Maybe mixed with some FSH, that's the IVF medications. Then she comes to the clinic, we treat the sperm, like washing of the sperm. Then instead of having intercourse during the ovulation, she comes in and we inseminate her. That means we get the sperm that has been treated by the embryologist, then we push it in.
Okay.
So, and we hope she gets pregnant. But if that fails, then we go to IVF.
So that would be done 3 cycles? At
least three.
3 cycles.
Some clients, some couple might be, oh, I don't want to try the second time. I just want to go move
away from
that and go to IVF.
What's the difference between that and the normal sexual intercourse between a man and a woman?
So is the percentage. So at least the sperm don't have to travel through the tube to meet the egg. So at this, we've cut the process short. So at least, let's say the normal consumption is like 20%, the IUI is like 30%.
Okay.
So IVF is like 50%. So you see that the percentages increases. So for some it works, but not everybody.
Not everybody.
Yeah.
So let's go back to when it comes to IVF. Why is it 50%? Why can't you say, okay, we guarantee is 100%? And when you hear people's, people say their stories, some will tell you they've gone through 6 cycles of IVF, 10 cycles. I've heard stories of people who've gone through 10 cycles of IVF, and yet nothing happened.
So I won't say we are playing a gambling game, but it's like 50-50 to be honest. So after we've sent the eggs, we've sent the sperm, we have different types of IVF. We have the conventional, we have the intracytoplasmic insemination. That's where you pick one egg, you pick one sperm and inject. Okay. So the conventional one is you have the eggs, you just pour the sperm and they do their natural selection.
Okay.
So for that kind of person, there's what we call pre-implantation genetics. That's another level of IVF. So that's after you've generated the embryos. An embryo is egg and sperm mixed together to generate an embryo. So that one, because now the IVF we are doing is just like we are looking at it and we're saying, oh, this looks normal, this looks good, but it doesn't guarantee the success rate. So PGT, that's the pre-implantation genetics, says, okay, if you transfer these embryos, you are going to get pregnant. But it's still God does that.
We still hinge it on God.
Because we've done the science part. So the implantation, we've not gotten to that stage that we can guarantee that this will happen.
Okay.
So at least, but the pre-implantation genetics is on that level that can tell you that, okay, this embryo has cells and this one doesn't have cells. So that one, that is almost like, it's higher than just the normal IVF, but we all know that one is still a bit expensive.
Yeah.
Okay, I'm more concerned about factors affecting reproductive health. Earlier you mentioned age and lifestyle. What are the other factors that can also affect reproductive cycle and health?
So, apart from age, as I say, the quality of embryos too, to be honest. Even though let's say the normal conception is happening, the same thing happens too, where you don't know that this one has cells and this one doesn't have. We have diseases too, like affect the tubes, like all those blocked tubes, endometriosis. They are other, like mostly just say medical conditions, just generalize a medical condition. So those ones too can affect. So, but if we don't come to test, we won't know what is happening.
Okay. Do we have environmental factors as well?
Well, we'll say yes to. Well, yeah. Environmental ways, if you look at it, environmental and like lifestyle is where we can put them together, because what is in the environment is the one that is affecting the lifestyle.
So men should not smoke at all or drink at all?
Yeah, if it's possible.
I like how you say if it is possible, because again, it's a matter of choice.
Exactly.
Right. So like you've mentioned that eggs and sperm cells can be freezed. Can embryos also be freezed? If embryos can be freezed, for how long can embryos also be fixed? Because I remember asking you for how long eggs can be freezed, and you did say you could actually have a plan to freeze for 5 years. Can you freeze over 5 years, and then the quality will still be top notch? Does the same apply to embryos?
It's the same thing too.
Okay.
So you can freeze, depending on how long you want them to be frozen, 10 years, just when you are ready.
Okay.
To be honest. It can be frozen for as long as, but we all know that people still come back before that 10 years or 5 years.
In Nigeria, where we have electricity issues,
no, we don't use.
No. I mean, so when it's a layman question. Yeah. When people hear you freeze eggs, they think, when you are freezing, is it something that will use electricity?
So we use more of nitrogen. Okay. So there is a place where we keep them.
Right.
So it doesn't, but the place has to be like a cold room.
Sorry, we need to take a break.
Wonders of God.
So this is one of the factors.
Oh no.